Parts of a wheelchair. The different components of the wheelchair are the seat. It is a basic component that rests the patient during movement from one point to another. It is made of metal or vinyl plastic. The footrest. It is a small platform-like component which is attached to the seat of the wheelchair. The patient can rest his legs on the footrest. Armrests. The seat is attached with two armrests which the patient can hold for support. Wheels. There are two pairs of wheels. The front wheels are small in size and are located under the footrest. The rear wheels are large wheels that are attached to the seat at the back. Metal skirts. The metal skirts are present on the rear wheels and are used by the patient for changing the direction of movement. Push bars. A pair of push bars is present on the backrest of the seat. They are used by the assistant to move the wheelchair. In addition to these core components, there are other components such as wheel locks to prevent movement, brakes to control and bring the motion to a stop. Besides these, there are many other additional features present on a wheelchair. Transferring a patient between the wheelchair and the bed. There are different techniques to transfer a patient between the wheelchair and the bed. You must follow the most common method that is safe for the patient. Some of the steps involved in the transfer of the patients between the wheelchair are as follows. Instruct the patient to move forward towards the edge of the seat on the wheelchair until the feet are flat on the floor. Place the hands of the patient on the armrests of the chair. Lift the patient and transfer onto the bed. Seat the patient on the bed and then raise the legs of the patient onto the bed. Make sure the patient is comfortable on the bed. Transferring a patient from bed to wheelchair. Before you start the procedure of transferring the patient from the bed to the wheelchair, collect information about the patient's condition from the nurse. Ensure that the patient is comfortably seated on the bed. Ensure that the wheels are locked to prevent movement of the wheelchair. Instruct the patient to use the armrests for support. Place the feet of the patient on the footrest of the wheelchair. Remove the wheel locks of the wheelchair and move the wheelchair gently to the ward that the patient has to be moved to. Place the medical records on the patient while moving the wheelchair. Role of hospital assistant. The wheelchair is the most commonly used equipment by you. Before using the wheelchair for moving the patient, keep the following points in mind. Discuss the transfer arrangements with nursing staff in charge. Contact the department where the patient is to be transferred with relevant information in order to ensure appropriate transfer. Ensure the patient is prepared appropriately and that the patient's condition is as stable as possible. Always transfer the equipment required for the patient along with the patient.